sir. My name is C. and I'm going to be your nurse responsible for today. So before that, may I ask for your name and for your birthday?
Ronald Wilson, January 6, 2001.
Thank you, sir. Today we will be performing a head and neck assessment. What is that for? So that we can detect any abnormalities in your body, and then we can do something about it, because it may be a cause for any underlying health issues. So first we're going to be assessing the head and the neck. So first we're going to inspect the head and the face for color, symmetry, lesions, and distribution of facial hair, and note the facial expression, as well as we're going to palpate the skull. Sir, is it okay if I touch you? After, we're going to inspect the external eye structures like the eyelids, the eyelashes, the eyeball, and the eyebrows, cornea, conjunctiva, and sclera. Note color, edema, symmetry, and alignment. So, sir. Note for any discolorations of the eyes, if coloration has jaundice or not. And then we're going to examine the pupils for equality of size, reaction to light by darkening the room and using a penlight to shine light on each pupil. So look directly across my head. We're going to check if our pupils are perla, which are pupils equally round and reactive to light accommodation. After that, we're going to test for pupillary accommodation and convergence, asking the patient to focus on an object as you bring it closer to the nose. So, sir, can you focus on my penlight? Once more. Thank you, sir. Using an ophthalmoscope, check the red reflex. So, sir, can you look straight at the ophthalmoscope? Next, we're going to test the patient's visual acuity with a Snellen chart, asking the patient to read the smallest possible line of letters, first with both eyes and then with one eye at a time. So, sir, could you please read the smallest line of letters that you could read with both eyes?
D, E, F, P, O, T, E, C.
Okay, one line up.
F, E, L, O, T, Z, D.
Another line up.
E, D, F, C, Z, P.
Okay, could you cover your right eye, sir? And again, read the smallest line of letters possible.
D, E, F, P, O, T, E, C.
Next line up.
F, E, L, O, T, Z, D.
Then the next line up.
E, D, F, C, Z, P.
Okay, now covering your left eye, sir. Again, same procedure.
D, E, F, P, O, T, E, C. F, E, L, O, T, Z, D. E, D, F, C, Z, P.
Thank you so much, sir. Sit down. With the patient about 2 feet away, ask the patient to focus on your finger and move the patient's eyes to the 6 cardinal positions of gaze. So, sir, could you please follow my finger, sir? Without moving your head, sir. Thank you so much, sir. Now we will be assessing the ears. So first, we're going to inspect the external ear bilaterally for shape, size, and lesions. And then palpating the ear and the mastoid passes. Sir, the other ear. And then we're going to palpate the ear and the mastoid passes. After that, we're going to perform an otoscopic examination for an adult. Pull the auricle up and back, and for a child, we're going to pull the auricle down and back. And then note the cerumen, edema, discharges of foreign bodies, and condition of the tympanic membrane. So, since our patient is an adult, we're going to pull up and back. Okay. Next, we're going to pull up and back. Use a whispered voice to test hearing. Stand about 1 to 2 feet away from the patient, out of her line of vision, and ask the patient to cover the ear not being tested. Perform tests and cover your right ear, sir.
One, two, three, four.
Okay, the next ear, sir.
1, 2, 3, 5.
Okay, thank you so much, sir. Next, we're going to use the tuning fork to perform Weber's test and Ryan's test if the patient reports diminished hearing in either ear. Is there any diminished hearing, sir? You can still hear.
I can still hear.
You still hear everything?
Yes.
Okay, thank you so much, sir. So there weren't any diminished hearing, sir, in either ear? Okay. Next, we're going to assess the nose. Inspect and palpate the external nose. So, sir, I'm going to palpate your external nose. Would that be okay? Next, we're going to palpate lightly and percuss over the frontal and maxillary sinuses. So, sir, this may be a little uncomfortable if you have swelling sinuses, but if not, then just tell me, okay? Does that hurt? Next, we're going to ask our patient to occlude one nostril externally with a finger while the patient breathes through the other and repeat for the other side. So, sir, could you occlude one nostril and breathe normally? Inhale, exhale. Next, the left nostril. Inhale, exhale. Next, we're going to inspect the internal nostril using an otoscope with a nasal speculum analyzer.
So we're looking little areas. I can see lots of redness there, but there's no crusting at all, and can't see any signs of bleeding. On the side, that looks good, and the turbinates look grand, and I can't see any obvious polyps. Let's check the same on the opposite side. Okay. Checking around Little's area, that seems fine. Can't see any signs of bleeding there. And the turbinates look good. and there's no problems there with polyps that I can see.
After assessing the nose, we're going to now assess the mouth. So first, we're going to palpate the temporomandibular joint by placing your index finger over the front of each ear as you ask the patient to open and close the mouth. So sir, I'm going to do palpating. Okay, sir, do you open your mouth? Close. Open again. Close. After that, we're going to perform hand hygiene and wear gloves. And then inspect the lips, oral mucosa, hard and soft palate, gingivae, teeth, and salivary gland opening by asking the patient to open the mouth wide and using a tongue blade and penlight. Sir, could you open wide your mouth and tongue out, sir? Okay, sir. Next, we're going to inspect the tongue and ask the patient to stick out the tongue. Place the tongue blade at the side of the tongue while the patient pushes it to the left and right with the tongue, inspecting the uvula by asking the patient to say "ah" while sticking the tongue out. Palpate the tongue for muscle tone and tenderness, and then remove flows. Sir, you open your mouth again widely for me. Put your tongue out, sir. And then if I'm going to push the blade towards your tongue, you're going to have to find it. Okay, sir? Other side. Sir, could you put your tongue out again, sir, and say "ah"? Thank you. Next, we're going to be assessing the posterior neck. First, we're going to palpate the forehead to the posterior triangle of the neck and the posterior cervical lymph nodes using the finger pads in a slow circular motion. We're going to palpate the forehead first, and then the posterior triangle, the neck, cervical lymph nodes in a slow circular motion. Next, we're going to palpate in front and behind the ears, under the chin, and in the anterior triangle for the anterior cervical lymph node. So, in front of the ears, behind the ears, under the chin, and in the anterior triangle for anterior cervical lymph nodes. Inspect and palpate the left and the right carotid arteries, only palpating one carotid artery at a time. Use the bell of a stethoscope to auscultate the arteries. Using the bell of the stethoscope, which is this one. After that, we're going to be assessing the anterior neck. So we're going to inspect and palpate the trachea. Palpate the trachea. Next, we're going to palpate the thyroid gland. Then if enlarged, we're going to auscultate the thyroid gland using the bell of the stethoscope to auscultate. Next, we're going to inspect and palpate the supraclavicular area. Then we're going to inspect the ability of the patient to move his neck, asking the patient to touch his chin, to chest, and then to each shoulder, each ear to the corresponding shoulder, and then tip the head as back as possible. So sir, could you touch your chin to your chest? Now chin to your right shoulder, chin to your left shoulder, and then look front, sir. Now your right ear to your right shoulder, your left ear to your left ear to your left shoulder, and then tilting your head as back as far as you can. Okay. Sir, thank you so much. After that, we're going to perform hand hygiene, and then we're going to document the findings of the assessment.